I'm Kevin Burciaga. I'm the author of the upcoming book by New Guide Physical Therapy called The Six-Figure Traveler. And I've been traveling since August of 2015, fresh out of school. I ended up just going straight from PT school to traveling, and I don't think it was a bad decision at all. I knew it paid a little better than your traditional job, especially like a private practice, significantly more than that. People take permanent jobs and they stay permanent. If you really like it, you're not going to leave, or it might be the place where you did an internship, and you're certainly not going to leave after that. So the best thing to do, I think, is to travel when you have no ties, no connections, no significant others, no kids. It's just you and your car, and you go. Because if you get too comfortable, you're not going to want to go travel, because you have to make some sacrifices to do this. It's just part of it. So if you want to have a very consistent life, like the life that you have in PT school, then maybe travel's not for you, because you're going to be moving, your scenery is going to be changing, the clinic's going to be changing, your coworkers are going to be changing. So if you like that consistency, then take a permanent job. If you're willing to adapt and be flexible and roll with it, as I like to say, then traveling is probably for you. You learn how to jettison things. So after every assignment, I got rid of things. You learn how to live a really lean life, which is a good thing. You will learn how to live with only the bare necessities. So that's one of the advantages. Travel definitely is part of travel therapy, don't get me wrong. But it's not like you're going to be seeing great things every weekend. And sometimes I just don't want to go anywhere and I want to stay in. But if there is a city or a geographic location that you want to see, find something 2 hours from your desired location, and you can still see the best of that area without paying the price. So it's kind of the best of both worlds. If you want to make the most as a travel physical therapist, make sure you're working 40 hours a week, so make sure that's in the contract. Go do home health in an underserved area, preferably in California. Central Valley, I know, pays really well. So you're not going to be in the glamorous places like, San Francisco or whatever, where you would probably make no money, by the way. But if you're in a place like Fresno and you're working 40 hours a week, seeing, 30 patients a week, that's probably the best way to maximize your income as a travel therapist. At the end of my first assignment, I was interviewing for my second assignment. They scheduled me with as many as 20 patients a day. If you want to avoid that situation, so this is something that new travelers need to know, you need to ask, will I be seeing one patient at a time? You don't want to be juggling patients. It's bad for the patients and it's bad for you. Double booking means if one patient cancels, they have somebody else that they can offer. They can offer that time to another patient. Okay. It's not the same as seeing two patients at once. Where I was, there were literally two patients in that particular slot. So you would see one patient, do kind of your manual stuff, and then the tech would see the other patient do the exercises, and then you would flip. But it was just crazy. If you had an eval and then you had two patients after that, it's a circus. Again, to avoid that situation, ask the right questions. How many patients in a day? What are the productivity expectations? How do you measure productivity? How many PTAs are on staff? Will I be working with PTAs? Will I be evaluating and treating, or just evaluating? What kind of EMR? That's just off the top of my head. Those are the questions I would ask. There's many more in the book that you should ask, but be very thorough. Take your time. If you have only 5 minutes to talk to the recruiter, then call back and talk more, because you really want to make sure this is going to be a good assignment. You don't want to get a bad assignment just because you didn't ask the right questions, because remember, this is 13 weeks at least, maybe more. So this is your life. Mentorship is tough in the clinical setting, especially as a traveler, especially if you're doing home health. Even in a clinic, you're probably not going to find a lot of that. The good thing is we live in a day and age where you can contact anybody and you can hire somebody as your mentor. So if you're in California, you can hire somebody in New York. So I don't think it's any different than being a permanent therapist. Don't work with more than 3 recruiters. 2 or 3 is the ideal. If you work with 1, you're probably not going to get the best deal. If you're working with 2 or 3, you can bargain with them because you can say, well, this other recruiter is offering this and you're offering this. Can you increase my package a little bit? So that's another way to make money, by the way. If you have more than 3, it's just you're getting bombarded with phone calls all the time, emails, they want to set you up with interviews, and then you don't want to tell them no, and then you feel guilty. No more than 3. So 2 or 3 recruiters is the ideal. The qualities to look for in a good recruiter is one that is going to work for you over time. So if you get a call or an email from them at 8 at night, it's probably a good thing. I know they're not trying to annoy you and they're probably workaholics, but that's the one you want. You don't want the one that's just there 8 to 5. You want one that's going to inconvenience himself or herself to find the right job for you. It's impossible to know what their true intentions are, but you can kind of tell in their intonation, the words they use, and you can tell which one is kind of a used car salesman and which one is really your advocate. Don't sign the contract without reviewing it. I know that sounds intuitive, and I know it's a lot of legalese. Make sure you read it, okay? Because if you don't read it, there could be a surprise on day 1, and then you're stuck for 13 weeks or maybe even longer. So do read the contract. Don't take 3 or 4 month contracts. I know this is controversial. If you take a 3 or 4 month contract, you never stay long enough to really master the system. And it's at the end of 3 months, that's when you actually start to make relationships with your coworkers. I mean, if you're super extroverted, you probably make friends day 1. But in my experience, I started to make good friends after 3rd month, and then it's time to go. So, and the other thing is, it's really hard to find short-term housing if you're on a 3 or 4 month contract, at least affordable. If you take a 6-month contract, you stay long enough to really master the system, you make friends, you make contacts, you learn the area, and it's so much easier to find affordable housing because you can sign that 6-month lease. It's not hard at all. So if it sounds like a really good deal and it's 3 or 4 months, maybe, but make sure you can find housing. I think the best thing to do is, before you sign the contract, figure out which days you need off. So you need to think ahead if you want time off as a traveler, but I mean, that's true in any job. Be flexible, make sure you know which days you want off, and I really recommend you get at least 1 weekday off per month. If you need to go see the dentist, then you can go do that. Or if you have an emergency, you can do that.